Welcome back to MedCity FemFwd. I'm Marissa Plescia, reporter for MedCity News, and I'm very excited to be doing my first ever in-person recording of FemFwd here at the MedCity Bullseye event in Chicago. Very excited to have Cheryl Larson, the CEO of the Midwest Business Group on Health here. We're going to be talking about employer strategies when it comes to women's health. But before we get into that, can you just tell me a little bit about what the Midwest Business Group on Health is?
Sure. We are 46 years old. We are one of the largest and more progressive employer coalitions in the country. We represent human resource and health benefits professionals from mid, large, and jumbo self-insured organizations. As a 501c3, we focus on education. It's probably what we're known most for. We also do employer-directed research projects. I'll share a little bit about that in a minute. And our members are close. They appreciate the collaboration and the peer-to-peer sharing, and we're a safe environment for them to talk to each other about what's going on. And we need more of that in today's environment. We launched 6 employer action briefs this year alone, which is a record for us. And they're all part of our employer-directed research projects where we invite employers to come and really help us understand specific topic areas. I want to share them with you because I think they're very important. The last one was the PBM contracting reset, what employers need to do now with the new legislation that came out. And we've been talking about PBM, lack of transparency, and all of those issues related to that. And we've been pretty outspoken about it. We also did one on employer and provider direct contracting and centers of excellence partnerships, which is going around the country more prominently than it had previously. We did one on GLP-1s. How are employers navigating the cost, and how are they contracting and covering it, and what the clinical value is? We also are about to launch one on the burden of inflammatory bowel disease, which covers Crohn's disease and ulcerative colitis, and the productivity implications of that are significant. We did one on reducing vaccine preventable diseases in vulnerable, high risk, and high cost members. And finally, we did one on hemophilia, which was kind of a part 2 that we previously had done when we discovered that vendors are charging way more for the hemophilia products out there, and gave employer strategies on how to resolve that.
Oh, that was great. Yeah, thank you so much for sharing that. You know, as I mentioned, we're going to be talking about employer strategies for women's health. What are you seeing from your members? What are some of the creative strategies that they're implementing to support women in the workplace?
What's really exciting is that I shouldn't say finally, because we've had a number of women's health programs over the years, but we're seeing more things being looked at and addressed, and programs from a chronic disease perspective and recognition that women's health is so important. So we're seeing them expand their benefit offerings and the programs that they do offer. Employers know that recognizing women's health is a workforce and a business strategy, and better women's health can lead to earlier diagnosis and treatment, improved health outcomes, reduced absenteeism and presenteeism. Many employers are unaware of how women suffer when they're working, and some have implemented some creative ways to work around that, like quiet rooms for people with migraines. We've always had lactation rooms, or at least in more recent years, but now we're looking at other ways that we can support their efforts. Higher employee engagement, lower costs, and greater health equity. And I think that that's a big part. I'm not going to go into a lot of detail, but there have been challenges of women getting supported at the work site and beyond, especially in healthcare from an equity perspective. We literally last night just got the results back from our annual employer member survey, and we asked one question about women's health, many other questions. So I wanted to at least share what our members are doing either currently in terms of women's health, or are considering in the next 1 to 3 years. The numbers in terms of they didn't know or are not doing were pretty low. Parental leave, and this means dads too. In fact, we have 3 dads that are members of ours that are taking the 4-month FMLA as part of this, which is really exciting, after their spouse took their maternity leave. So really exciting to see that transition. Parental leave, 83% are doing it. Another 8% are considering it in the next 1 to 3 years. Maternity support, 72%, and 17% are considering offering that. Reproductive fertility services, 58% are doing it. Another 22 plan to do it in the next 1 to 3 years. Mental health services, 50%. I think this is beyond the traditional EAP services. So 50% are doing that, with 36 considering doing it. Probably one of the biggest changes we've seen an increase in numbers is menopause support services. 43% are doing it now. Another 37% are thinking about doing it or considering it in the future. And then finally, caregiver assistance, which I think is a huge gap. So, sandwich generation, but especially aging parents and things like that. 31% are doing it, 36% are considering it. So we know that all of these impact productivity and absenteeism, and also retention, which is a huge issue with employers. So yeah, that's where we're at today.
Yeah. Thanks for bringing those findings. So yeah. So going off of that, what are some of the areas of women's health that you feel like are like a really hot topic right now for employers? And what are some areas that you feel like, aren't getting as much attention that you feel like they should?
Well, I think in recent years, we've seen more employers look at flexible work arrangements. We're also seeing more preventive screenings and vaccinations being brought to the work site or made available. Of course, most of them are covered, but just talking about them is important to make sure the employees and their family members go to the doctors and get screened. There's a growth in digital navigation and advocacy services. One of my favorite parts is the care coordination across the lifespan. So it's maternity through menopause, and then also looking at the aging workforce. I am one of them, and the needs of older women. And then, of course, we're seeing more technology and therapies in the cancer space as it relates to women. So cancer navigation and survivorship services, musculoskeletal. And then migraine, huge in this space right now. Migraine and menopause, probably two of the key ones. And then cardiometabolic health, which of course is your obesity, diabetes, and hypertension. Again, all of these areas also have significant implications for employee well-being, absenteeism, productivity, and spending. I think it also reminds employers, if you're not doing this, it's almost like an audit. If you're not doing these things, you need to see if you offer it or your carrier offers it or someone else offers it. There are also a number of chronic diseases that we need to be paying attention to that are specific to women. Well, they're not just for women, but like heart disease, the top cause of death in women. Autoimmune disorders like rheumatoid arthritis, MS, lupus. We already talked about obesity and diabetes, but when I looked at the mental health stats, menopause, depression and anxiety, perinatal and postpartum depression, stress and burnout, often related to work challenges, sleep disorder, I relate with that, substance abuse disorders, and eating disorders. So the list is long, and there's a lot of work we need to do.
Yeah. So how do employers go about effectively supporting all of those needs? What kind of vendors are they looking for?
Well, the first thing I want to mention, and I mentioned, I didn't mention it earlier, but the top thing about being overlooked, and you mentioned that earlier, is limited representation of women in clinical studies. It's been going on for years. I found this quote: "Male bodies have become the default, and researchers often assume that findings in men would apply equally to women, and they're wrong. They don't apply equally to women." So I've only seen it recently start to change, and people pay attention. How do we fix that? How does an employer fix that? Well, the researchers need to enroll enough women to detect meaningful differences in a therapy or a test, analyze and report the results separately for women and men when needed, recruit participants who reflect the diversity of the populations that ultimately will use the treatment, and generate evidence that supports equitable and effective care for women across all ages, all life stages, and all backgrounds. And now I come back to answer your question, which was what again?
It was like, you listed off so many, different, women's health is often considered or thought of to be such a niche topic, but you listed off so many different women's health conditions or conditions that affect women differently. And it's not niche, it's actually very broad. So how do employers go about, tackling all of those different issues and effectively supporting women in their workplace?
Well, it's interesting because I think employers need to evaluate the vendors that they currently have and then see where their gaps are and talk to other vendors. And you have to ask a series of questions that's going to get you what you need if you're trying to address a specific population. There has been inconsistent insurance coverage for hormonal and non-hormonal treatments. And I actually have at the top of my notes, one of my employees let me know that she went on hormone replacement therapy. She went to the pharmacy for a 3-month fill. They only had 1 month available, so they sold it to her. And the plan would not cover that therapy if it wasn't 90 days. So what does she do? She needs that medication. So I think those kind of plan designs are inhibiting women. You've got to ask your PBM or your carrier, whoever is running these things, what they're doing. You've got to address those barriers in your plan design. And the pharmacy could have assessed it or resolved it by doing a partial fill and then ordering more. And those things are not happening. So I think we need to be aware of what's going on potentially in the market that's going to prevent someone from not having access to the medications that they might need. But getting back, I wanted to share some of the other things that we see employers are doing. We talked about evaluating vendors, looking at organizations that are advancing women's health research. So your vendors should be doing that. Encouraging participation in clinical trials that improve representation of women, and asking health plans. I think this is really a big one. Carriers' health plans, how they are addressing these differences in care. And then when I was doing research on the menopause area, there's been limited access to clinicians trained in menopause management, inconsistent insurance coverage, which made me think of this story. Lack of workplace policies, and manager education. And you'll see another point I make here is that a lot of our supervisors are male. Not a lot of them, but many of them are, and they don't understand what's going on or how to support the females in their workforce, so they need to be educated. And the same is true of PCPs. So that falls on the health plan or the medical group. They need to be supporting women. With heart disease, delaying the diagnosis, that symptoms present differently. There's an underuse of preventive screenings and limited awareness among women and clinicians. I also wanted to share that employers need to examine if their menopause support is fragmented or underutilized. Are they tracking that? Who could help them track that? Employers can make meaningful progress by integrating menopause support into their existing healthcare needs, their leadership stories, and the benefit structures. This is basic stuff, but it's easy things to do, easier. I already said it, train male managers and get male PCPs to recognize and address the specific challenges of women. And some of our members have shared that by strengthening support, they can do it by auditing their benefit plans and their formularies to identify gaps in cares and coverage, and encouraging managers to have compassionate conversations and communicate available resources in ways that are relevant to the employee's life stages. There are navigating companies out there and communication companies that are targeting maybe mom in a maternal environment or with children, as well as those with menopause or migraine challenges, as well as those on HRT, as well as those that maybe are about to retire and what that means to their benefits. So there's a lot that can be done.
Yeah, very well said. And there's also, economic factors to consider as well. And you've touched on this a little bit. But, some of these conditions are very costly for employers, like menopause, for example. Can you talk a little bit about that and why employers should be paying attention to these issues?
The first thing that comes to my mind is productivity and absenteeism and presenteeism. And the story I shared earlier, I really felt the passion of this colleague of mine in what she was going through and the profound change in her life when she got HRT and how it made her feel. The analogy I would make, and this is unrelated, I had both of my knees replaced maybe 15 years ago. It changed my life. It took me from being sedentary to being able to get out and exercise and walk again. And I'm profoundly grateful for that. We deserve to have the same quality of life as any other person on this earth. And that's why it's so important. We need to be paying attention to it and not just checking a box.
Yeah. Yeah, so well said. Well, Cheryl, I just have one last question for you. What's your message to employers that you want them to know about how they can better support their women workers?
We as employers have a significant opportunity to improve a woman's health at the workplace and at home. And it's not just by enhancing benefits, but creating, we didn't talk about culture yet, but creating a workplace culture that recognizes the unique needs of women across every stage. And the most effective strategies are combining the benefit design, the workplace policies, education, and data-driven measurement, and engaging the vendors in this. They have to be part of the solution. I kind of created a little list of things that I'm seeing that are working. So expanding access to comprehensive women's health care, addressing the gaps, improving plan design, and some of these I'm repeating, but they're important enough to repeat. Reducing the financial barriers and like low or no cost preventive services. That's one of the easiest ways to do it affordably and ensure people will engage in that service. Supporting them through every stage, which I talked about a lot because I'm very passionate about that. Normalizing the conversation around women's health with your leadership team and employees in general. Training managers, creating employee resource groups, hosting webinars, sharing evidence-based resources, encouraging prevention and preventive care without stigma. That's really, really important. Offering workplace flexibility, so remote work options, paid parental leave, caregiver leave, time off for medical appointments. And that should be for everybody, not just for women. Return to work support after childbirth or female surgery. So now you're in an environment where you're recovering and you have no support if you don't have a family to help you. A huge focus on mental health in this space. So easy access to behavioral health providers, maternity mental health support, stress management, caregiver assistance, and crisis support. Identifying data gaps. So analyzing claims and utilization data by sex and age to identify what your disparities might be. Tracking preventive, I'm almost done. Tracking preventive screening rates, maternity outcomes, mental health utilization, cardiovascular risk, cancer screening. And I didn't talk too much about obesity and the use of GLP-1s. And it's a tough one. We recently conducted a survey on our employer member use of GLP-1s. And the larger the employer, the more likely you were covering it for both diabetes and obesity. Mm-hmm. The smaller the employer, you were likely covering it for diabetes, but not obesity. So costs have to come down. Direct-to-consumer, direct-to-employer programs are out there. And you can't just give the medication to someone. There has to be comprehensive care built around it. Mm-hmm. We talked about musculoskeletal conditions, and then it's going to all influence your spending trends. And then in terms of making vendors accountable and how you can work with vendors like health plans, how are they measuring improvement in women's health outcomes? What disparities have they identified? What evidence is supporting their programs? Because otherwise you're just paying for something that you're not getting any value in. How are they addressing menopause, maternal health, mental health, and chronic diseases? Those are data points that you can focus on. And then what kind of engagement are you getting and clinical metrics that they're reporting? And really, in the end, helping employers move beyond traditional benefits towards an integrated strategy that addresses prevention, equitable access, high quality care, and outcomes across the full continuum of women's health is the right thing to do.
Yeah, that's a great call to action there. Cheryl, thank you so much for joining MedCity FemFwd. This is
Thanks for having me,
great
Marissa. Appreciate it.
Yeah.